Hello and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and joining us today, a return visit. It's like this time of year too. Cheryl Bartlett, the CEO of the Greater New Bedford Community Health Center, is with us as winter rolls in, and illness seems to be on the top of everybody's mind. It's the top stories when you look at newscasts and newspapers. It's crazy out there right now. But thanks for coming in. We appreciate it.
Well, thanks for having me. I always enjoy seeing you and informing the public on what I know about what the latest and greatest is in public health.
It is, the big word, I guess, the word that I'm learning is the Tripledemic that is out there, that health officials are battling and people are dealing with as well. COVID, obviously still prevalent. The flu, according to the federal government, it's the worst flu outbreak in a decade. And then RSV, which we'll get to because I don't know what RSV is. But just give me the overview right now from what you are dealing with right now at the health center. Same thing. I mean, this tripledemic is really affecting everybody.
It is. Talking to my providers, particularly in pediatrics, they're seeing the kids really coming in with all three of those. Primarily RSV is really rising in the pediatric population. And our staff, I would say flu is the thing I hear more of. I think everyone's go-to is COVID because we were so COVID focused for so long.
Right.
And because we wore masks, we weren't seeing people get some of these other illnesses over the last few years.
Tell me about RSV, because I think people, they've heard of flu, they know about COVID, whether they agree with it is a whole different thing, but they know about COVID. But I don't know if people know what RSV is. Why don't you tell us a little bit about that?
All right. It stands for respiratory syncytial virus.
It's an easy word to say.
RSV. Yeah. I know. I had to practice it a couple of times because my tongue twirls over it. But it's a very common respiratory condition that we see in kids. And hadn't really seen it for a while. Again, I think the fact that we were wearing masks, and I think it's becoming more and more clear that masks are really big preventative intervention that we can all do easily and cheaply, and that's an important public health strategy that I think we were so sick of wearing masks every day, all year long, that once we could free ourselves, and I will count myself in, that wearing a mask is really uncomfortable and you had to do it every day. You and your staff had to do it every day. And so now we still do it every day in our clinical areas, anywhere where the public or the patients are coming through. But in our non-clinical areas, it's optional.
What are the characteristics of, and the one thing I read about RSV is kind of what you just mentioned, is that most kids get RSV at some point in time in there as young children.
Right.
But what are the characteristics of RSV versus, say, the flu when you're trying to diagnose that?
Well, really, what it often comes down to, the symptoms are very similar, right? We start sneezing, coughing, getting congested, oftentimes rising temperature, lethargic, just general malaise. So it's really comes down to the tests that we do to be able to distinguish between them.
And also, it's an issue for senior citizens too, or elderly.
Correct.
I don't know if there's a gap or an age when you're more prevalent to get it, but they say elderly are susceptible to it.
Right. Again, that's about your immunity. Kids are young and haven't totally built up their immunity, and a lot of kids getting RSV, what's common in daycares, you see that a lot, the transmission. So daycares closed, kids not in school, so many of these illnesses we didn't have the same level of exposure to. And so we're seeing it back. I think what's notable for RSV is because kids are getting sicker with it, and sometimes people are getting two of those three at the same time. And so that will kind of double your dose, so to speak, and your symptoms from having two different illnesses. But again, just not going to school, not being exposed, you don't build up some doctors, and there's some debate that people are arguing on both sides that having those exposures are actually good for us because we do build immunity, and by not getting exposed, then we get exposed to it. We're more likely to get it. We might get sicker. And that the kids, a lot of the pediatric beds in Massachusetts have closed down. I don't know if you've seen that as part of the news. That's a big story because the kids are requiring hospitalization and there aren't enough beds. So I think there are only 5 or 6 hospitals with pediatric units anymore.
I saw the number nationally. I think the CDC had it up yesterday or whatever the latest figures came out. Like 77% of the ICU beds in the country are filled right now, and most of it is flu.
Right.
And that there are a number of hospitals that, again, have elected surgeries and stuff have been postponed because of the surge. And talk for a second, because the one thing everybody's saying is all 3 are surging right now at the same time.
Correct. It's the seasonality of these viruses. That's typically, and again, if you think about it, I think we learned a lot from COVID as a country, is that when you're outside and more active and not in close quarters with people who are symptomatic with respiratory conditions, you're less likely to get it. So it's a seasonality of the virus. Now we're all inside. And for the last couple of years, our parties were very limited. 2020, almost no gathering socially. 2021, during the winter season, there were still restrictions in place.
Right.
So many Christmas parties, Christmas festivities.
New Year's is the same.
That we didn't see large groups of people congregating without masks, partying. When you're out at a party.
And you know, it's funny because you and I were chatting about that too, is how the last couple of Christmases, and you and I always talked about that, very small.
Right.
And there's something to be said for that. You know, the results of having smaller get-togethers.
Right. First, you can know the people better, and hopefully people know if they're ill to stay away. I think one lesson we did get out of COVID too, another lesson, is that when you're sick, we were kind of laughing at work the other day that we all came in with colds no matter what, right? Because we had to work, or we didn't want to let down our coworkers and leave them short-staffed. But we're really learning that when you're symptomatic with respiratory conditions, the best thing to do is stay home and stay away from other people. And masks are still out there. I think we quickly discarded our masks, and masks are cheap, easy to get, easy to use. You don't have to do it all the time in the way it was so intense with COVID, but if you're going to go to a gathering of even 10 or 12 people and you're afraid that you might get ill, wear a mask. Masks are voluntary, but they're protective even when it's one way. If I'm the only one wearing a mask in a room, I'm still getting a level of protection that can help me. And vaccines. I think our vaccine level has really leveled off, and people even getting the booster, this new booster that's recommended for COVID, and many people didn't get flu shots. The flu shots went down during COVID. I think, again, we were so focused on COVID that we didn't think about the flu shot. So getting a flu shot, getting your COVID vaccine if you haven't been vaccinated, getting the latest booster if you're behind on that. Those all help to reduce transmission, and they also help to reduce the level of illness that people get when they're exposed to
And I think that's a good point to make too, because I think the perception still, and we heard it with COVID, but even with the flu, the vaccines don't prevent you from getting sick.
Correct.
They prevent the severity of the illness that you get if you get it.
Exactly.
I saw, and we were talking off camera, roughly 50% of the country has got the flu shot. And I think those numbers are pretty consistent, which is kind of surprising because they said the efficacy of the flu shot this year is actually better than most years. It's a good match to the flu strains that are out there.
Yeah.
They said it was 60 to 70% effective against the flu.
Right.
But people aren't getting them. And I
Right.
think I think the COVID vaccine has affected the flu vaccine, and just vaccines in general, really.
Exactly. And again, there is some people that are still anti-vaccines, which is kind kind of concerning because it's so clear, and almost everyone that gets it says the same thing, that they were so glad they were vaccinated because they didn't get as sick as people that got exposed in the same location who didn't get vaccinated. So it clearly is a public health preventative measure and a reduction in how ill one will get. And hospitalization, again, people that are vaccinated typically don't get sick enough to be vaccinated unless they have other underlying conditions. And those are the people that really should be thinking about wearing masks wherever they go during the time of year where you're indoors with a lot of other people.
With your career, and you've had obviously a lot of career dealing with this, but I'm curious from your standpoint at this point in time, when you look at all three of these things going on, have we ever seen anything like this before? All three of these at the same time?
I don't think to the severity that we're seeing it. And again, smarter folks than I, scientists that study these things, really some are attributing it to the fact that we wore masks for 2 or 3 years and we didn't get exposed. And I think I mentioned, even people with environmental allergies that tend to give us symptoms that are somewhat similar to a respiratory condition didn't have as many allergy symptoms during the time we were all wearing masks. So I can't emphasize how important masks are, and that again, we don't need a law or a mandate in order for us all to wear masks. I keep a mask with me at all times. And I have noticed in the last week or so, with all the media attention about these 3 viruses going on, more people wearing masks.
Yeah, when you go into the stores and stuff like that now, you are seeing, I think, still not as many as before, but there are people that are wearing them. The one thing too with, as you were talking about the vaccines, the COVID vaccine, I think the country now is up to 80% have got at least one shot. I think I saw the numbers that I got is 68% are, quote, fully vaccinated.
Right.
But the boosters are not
way down.
Way down.
Yeah.
So more than half the country is got the first couple, and then there's talk now that these are going to have to be annual shots, just like the flu shot for COVID.
Right.
That's got to be a concern because, COVID hasn't gone away.
Right. And I will say, I hate to say I'm guilty. I had my first booster. I never got the second booster. And every time I go to think about scheduling it, I think about planning to be sick for a couple of days. I myself have been sick with each dose that I got of the COVID vaccination, sick enough to be out of commission for 2 to 3 days. So with the holidays coming up, I thought, oh, do I get it? And I was going to see my family for Thanksgiving, and I thought I didn't want to be sick for 3 days. And so I'm trying to figure out when to get it. There's a lull in life, and I'm thinking mid-January, once we're through the holidays and I can stay home for a couple of days. But I think that people that got sick from the vaccine have had some hesitancy around when and if to get the booster.
I know the city, when they had their wellness fair in November, I know the staff and I got the flu and the booster at the same time, the second booster at the same time. One of my arms was sore than the other, but are you still finding 3 years after this, well, I guess it's coming up on 3 years, that you're still trying to educate people that are coming in, that are talking about getting the boost, not getting the booster, but just getting the shots? Are you still having that, I don't want to say that fight, but that debate with people?
I would say each individual provider, it's now on an individual provider to provider level than hosting big clinics, because the numbers really dwindled and it wasn't a really effective use of resources. But anyone that comes in that isn't up to date on vaccines, we have a very strong focus on it. The nurses every day communicate with one another if they open up vials of vaccine, because there's a useful life of once you open a vial for vaccinations, that they let each other know so that they can pass it around the health center and use one vial at a time so we don't waste it. So it is very much a part of our everyday conversation with our patients, particularly focused in pediatrics because that's a newer vaccine that's available. The state has an incentive program right now where they're given $75 gift cards. Believe it or not, sometimes a financial incentive gets people to do things for their health that they normally don't do on a day-to-day basis. So that seems like that's getting a little bit of traction.
Are you, because obviously, I don't want to say, I guess it's the new normal. You've got organizations and things, people are doing things that they did before COVID now and sort of the same way that they did. Is that a concern to you just in general as you look, not just now, but long term? Or how is the new normal, I guess?
Right. I think that where I see it now and what I see the advice being given from the CDC and departments of health is that we have to each assess our individual comfort and risk factors, right, and decide, because I think we're also learning that completely locking down a country, a state, a society has other bad effects. Look at our kids. Our kids are like 30% behind on their education. Their social and cognitive development is really behind. Those all have public health implications. So I'm one who always tries to balance what's the greatest good for the most people. And I really feel that the schools that closed down completely and we really see the kids virtual learning wasn't really good for every kid. The equity issues around remote learning and technological skills and just even having the equipment that they could use to do it really hurt our kids. It hurt our economy. It hurt low-income families. So I do think unless it really is knocking everybody out, that we need to really decide. And every day, if you think about it, these things become part of your life and daily decisions, how we drive, driving fast, do you wear a seatbelt, do you smoke a cigarette? These are all individual public health decisions that we try to get messaging out in the biggest way to get the biggest impact. So I kind of feel that we're at a place, and I don't know if you saw recently, I think 25 Republican governors came together and they're writing a letter to the president to say not to keep the emergency on for COVID, that we really need to rebuild our economies and our communities. And
well, that's the big issue too right now going on in China. When I read that the other day, as a matter of fact, because they've had the lockdown, serious lockdowns, and now the people are in China protesting because the economy's just tanked.
Yes.
So I mean, you see that in the biggest country.
Right.
And
people get fatigued by epidemics and pandemics that go on for too long, which also leads to a change in behavior that's less protective. So someone not getting vaccinated and not wearing masks is, I think we were so overwhelmed by that mandate for so long that, again, public health messages sometimes just don't sink in after a while, and sometimes you need a break or you need to think about a different way of monitoring and measuring and implementing interventions.
The interesting too is that I did see that there are, not here so far in the country, but there are, I mean, COVID is changing. There are different strains of COVID. And it seems as though the boosters, I know right now from what I read and what I've seen on from health officials, is that the booster is effective versus some of the new strains, but there are even more strains.
Right. I'm losing track.
But so when people don't how does that work? What is happening when it says, oh, well, it's mutating, it's different? Yeah. This goes on all the time with illnesses.
Yes, with viruses in particular. Somebody described it to me once in a way that really made so much sense to me, right, is that they duplicate themselves, the virus, like rapidly. And so hundreds of thousands of copies of new viruses are getting made every second, minute. And so think about taking a document that you've just typed up and you're going to print 1,000 copies of it. So look at the first copy and look at the 1,000th copy, and it changes, little minute things. Maybe it's not as dark, maybe a little piece of a letter is not there anymore. So this is a virus copying rapidly, and it doesn't duplicate itself exactly in that rapid growth.
So when people say, and people, oh, well, COVID, oh, it's not effective, whatever, the issue is that COVID is changing. So, I mean, as health professionals, and you're adjusting to what the virus is doing as well, when you're trying to come up with vaccines and things to fight the disease.
Exactly. And so some of it is, we've studied these vaccines against the primary variants that we had at the time, and then they have to go back and get subjects again to kind of see, is this going to be effective? I think the most important thing that they look at too is the severity of illness. Viruses typically do what this virus COVID is doing, which is, again, rapidly reproducing, often being more contagious because there's more of it out there and it's new variant of it, but not making people quite as sick. They call it burning itself out, that they duplicate, and eventually everybody's had it to some degree, and that there's no sort of fresh host for that virus. Viruses grow by continuing to infect hosts, and we're the hosts for the viruses.
The other big thing that I know there's been in the last couple of days, and you're probably dealing with it at the health center too, is that I see that Walgreens and CVS are limiting the amount of medicine, I guess, you can get for some of the illnesses that are going around.
I had not seen
that. And it's not so much, and it's, I guess, Tamiflu, and I'm just name some of the basic over-the-counter medications that, and it's not because there's a supply chain issue. I guess it's because it's tied into the fact that, as you said, the last couple of years, there hasn't been as much illness.
Right.
So there wasn't a demand.
Right.
And now there's a huge demand and there's no supply.
Right.
But that's got to be a concern because, and you're dealing with parents with kids every day, that if they can't get, and I don't know what the medicine is that they would get their kids, Tylenol or whatever it is, but there's not as much of it right now. But apparently,
that's a problem.
Apparently, they'll catch up at some point. But at this moment, there's a shortage.
Yeah. And the other thing I learned recently, last week, in talking to some folks that work with the different cultural communities here, and particularly the Guatemalan population that we see growing, is that some of them aren't even familiar with over-the-counter medications because they come from places that don't really have over-the-counter medications, not to the degree that we do. And so even just educating people that there are these products they can get instead of going to the emergency room, instead of going to somewhere else where maybe you can manage the symptoms at home.
Is that still an issue that you're seeing? Is that for I don't want to say a lot of people, but for many people, that they do go to the emergency room for, and I don't want to say it's not important or not serious, but it's not something that I guess ERs are intended for.
Right. We call it low acuity emergency room visits, right? Because we monitor that because we want to try to redirect people to the sort of lowest level of care that will take care of their problems, so that hospitals are really available for people that are the most ill and need that level of intensive care, so to speak. So yes, that is a problem. And it was interesting, again, when you talk about during COVID, because people weren't going out and emergency rooms and hospitals were sort of on a semi-lockdown too, we saw the number of our patients. We have a number of patients that go every day to the ER that could come to us.
Really? Yeah.
And again,
you're open all the time. You're 7 days a week.
6 days.
6 days.
We're not open Sundays.
But
and they go to the ER while we're open. So We're trying to look at why that is. Some of it is that just we're so used to that, that's always sort of the place of last resort that you can go. People must see it as more convenient in some way, so we're trying to understand what barriers we may present to people so that they might come to us. But we have about 40 or 50 people a day that go to the ER, and I'm going to say half of them could really come to the health center.
Is it a cultural thing too that you're seeing? Like in New Bedford, I guess more than the other places, and I know a lot of towns watch the show, but in New Bedford, is the cultural issue a challenge with that issue?
I think to some degree. I think that we all know that you can go to an ER and they can't refuse you care, and there are still people that maybe don't know that the same holds true for us, that we see people regardless of their ability to pay. And so coming to see us is important. I also think there's some level of concern around safety and trust, particularly for the immigrant community, and undocumented people in particular worried about going places. So there is still education to that community about where they can go, where they're sort of protected. Health facilities have always been a protected place for immigrants, no matter what their documented status is. But during the previous administration to the Biden administration, there was some talk that they were not going to be protected in places like the health center. And so I'm sure that some of that information still concerns people, right, and they don't know where to go and be safe.
And for a quick definition too, because we've got a couple of minutes left, but I wanted to ask, as we're talking about this, the difference between the urgent care facilities, right, and the ER. What is that for people who don't know?
Right. I would say ERs should be for really serious, life-threatening illnesses. Urgent care can really take care of a number of things. They can do labs, they can do radiology, so many things. So I would say if you can manage it yourself, but you're uncomfortable or just not feeling well, you're not getting better, urgent cares are definitely good. And honestly, they'll get you to an ER as fast as possible. Like, we have urgent care. Someone comes in.
Exactly. That's why I brought up urgent care, because you have that.
Right. And we would have an ambulance there in 2 minutes if someone is beyond the capabilities. So minor acute illnesses, urgent care. And again, a lot of people go to ERs for minor things that are just maybe they finally have gotten to the level of it bothering them that they want to get it taken care of right now. And so then ER is the place you can think of that's open 24/7.
Quick, we got about a minute and a half. I just want to give you two things here. First is just a final message for people as we get into winter now.
Yes.
What is your final message for folks?
I would say keep your gatherings small. There is you can have fun in small groups of people as much as large groups. Wear masks if you have any level of concern about getting any one of these respiratory conditions, and get your vaccines up to date.
And for people who have questions and don't know about where you folks are and need information, tell us where they can get in touch with you guys.
We are on Purchase Street, 874 Purchase Street, and I never remember our phone number, I'm sorry to say, but we do have a website. The
website is fantastic, by the way.
Gives a lot of information, and our phone numbers, and we have a tremendous call center staff that really try to help you on your first contact with us, and if it's something they can't help you with, they'll send you to the right person. Hours of operations are there, and names of doctors. I mean, your website is very informative. Yes, we see patients starting at 8 a.m. till 5:30 p.m. Monday through Friday, and Saturdays urgent care only from 8 a.m. until 4:30 p.m. Lots going on. It's great seeing you. You too. I wish you a great holiday season and New Year, and we'll stay in touch with you. I learned something new from you every time you come in, so I appreciate you coming in, and this is a good show to get out there right now. Thank you. Thank you very much. That's going to do it for this edition of A Conversation with Cheryl Bartlett, my guest again, and I appreciate her coming in. Thanks for watching, and we'll talk to you again soon.